Welcome to Growing Bremerton Together with Mayor Patty Lent. We're on location today at the Bremerton High School, their TV media studio. I have an exciting trio that's going to be my guest today. Michelle Dower, she's our program manager and student servicing with Olympic Education Services District. Jeff Streck, assistant principal from Bremerton High School, and also Laura Hyde. She's with Kitsap County Substance Abuse Prevention Specialist. Stay with me. Today we're at the Bremerton High School in their TV studio. I have Laura Hyde, Kitsap County Substance Abuse Prevention Specialist. I have Jeff Streck, he's assistant principal for Bremerton High School, and also Michelle Dower, she's with Olympic Education Services District. We're going to learn a little bit about abuse and prevention. We are bringing prevention to the high school, and we'll see what this program is like. I want to start with you, Laura. First of all, how long have you been in Kitsap County, and a little bit of your background before you landed with the county?
Sure. Well, I've been with the county for 6 months now, but I've been working in the county in human services for over a decade. I spent time with Olympic Educational Service District, working on youth workforce development, developing programs for leadership for youth as well. Prior to that, I was a teacher in Tacoma Public Schools and spent a lot of time working in a variety of fields. I interned in a law office for a while. Lots of interesting things that wrap right into public service.
Great. Were you born and raised in Tacoma?
Yes.
So was I.
So
north or south end?
North.
North end, okay, me too.
Yeah.
I went to Wilson High School.
Oh yeah, go Rams.
And so with you, Jeff, let's move on and just learn a little bit about, I know you've been a long-time resident of Bremerton and a long-time educator as well as now assistant principal.
That's correct, yeah. I came to Bremerton in 1989, first teaching job, and have been here for the past 24 years. Been an administrator the past 6, and feel very fortunate to have landed here in Bremerton.
So the teaching that you provided was in what?
I taught math.
Math.
Yeah, all levels, and missed that, but enjoy my new spot.
Your original home?
Walla Walla, Washington.
So still a Washingtonian.
Right.
Thank you. Thank you. I'm glad you're with us. And Michelle, tell us about your background.
So I've worked for Olympic Educational Service District for about 15 years, and my primary role is to coordinate and oversee the drug and alcohol prevention intervention services in the schools. And prior to coming to the ESD, I worked in drug and alcohol treatment programs. So I have about 20 years of experience in the substance abuse field.
And since you have the microphone, have you seen an increase of the abuse of addictive drugs and alcohol?
I wouldn't say I've seen an increase in certain drugs. We've certainly seen an increase in marijuana over the last 10 years. Prescription drug use was on the rise, but now we're starting to see it drop again because we've done a lot of education with adults and with kids. But no, not anything huge and dramatic.
So since you're a little broader than just Bremerton High School, where have you been focusing on prevention?
Well, in the past, we serve 15 school districts all the way up from Forks down through North Mason. And unfortunately, in the past number of years, we've shrunk. Funding has shrunk. And so primarily, we have services in Bremerton. We have a little bit in central Kitsap and some in North Mason in terms of the surrounding area here in Bremerton.
And are you the only one that's doing this specialized program?
In terms of the school-based services, yeah, the ESD is the primary service that provides that and receives funding from the state. And as well as districts contribute dollars as well because they find a large value in getting the drug and alcohol intervention services out to kids.
So Jeff, when this program was first proposed, were you in the ground floor? Was it something that I know you're involved in it, and I see the benefits that we can get from this, but how did Bremerton step up? Because it's the only one high school in Bremerton.
Right. Yes, I was just invited, probably because of my role in the high school as an assistant principal, to join the coalition and jumped at the opportunity. It was a nice fit for the services that we provide within our school currently with Patty Scambolone, who works with Michelle, and some of my contact and my role as an assistant principal from times has an element of substance abuse, and it's nice to be connected with a group that is trying to prevent that before
Is
it gets
Patty
started.
here on campus?
She is on campus. She's in our building full-time and is a nice resource for our students. She does a number of activities with students from a prevention standpoint. We hook up students if they're ever, have an issue with that at school, a school-related issue. She provides a service that allows, that if students are willing to participate in that, we're able to bring those students back to school sooner than if they were not a part of a program like that.
That's great. And then Laura, with the county, what kind of support system, and I know the coalition, having been at one of your first meetings, you had so much energy that was going through those members. They really wanted to see some strong results of this program. So again, the county's role?
So the county is receiving funds to support the development of this organization. And so our funds come from the state and originally from the feds.
Correct.
And so what we're doing is helping to organize the community around prevention activities in Bremerton.
Well, my emails normally come from you, and talking about meetings, tell us a few of the people that are involved in the coalition.
Okay. Love it when you mind blank. Oh my goodness.
You can address which sectors maybe are
All right. Well, we have Michelle Babs, who's involved in our faith community. We have...
And you don't have to name them, but just the types of organizations that are really working strongly on this.
Okay. So we have Kitsap Mental Health Services as an active partner, Department of Social and Health Services, Kitsap Community Resources, and help me.
A volunteer, Coffee Oasis.
Coffee Oasis.
Oh, great.
Strong partner.
Yes.
You had someone from the prosecuting
Oh,
attorney's
yes,
office.
we have our Todd Dow from the Juvenile Department Prosecuting Office.
So anyone or any student, high school student that would have exposure to or a problem with a substance abuse, this is the one we're trying to reach. And we also want to educate everyone that's in the schools district, or especially high school, of the ramifications. I know there is, I worked on, and I do not recall, so if you can help me with this, the mission and the vision of this coalition. So if you want to read that, or we're going to put that on the screen, I think that's very important. We really worked diligently on seeing if we could have something that would give us goals to set out for. So I'm going to have you read both of those.
I'll read it because we have a very long mission because we have a lot of work to do. So our vision is Bremerton is a healthy community that educates and engages all youth in a hope-filled and substance-free lifestyle. Our mission, the Bremerton Substance Abuse Prevention Coalition, will provide opportunities for youth to be in a safe and substance-free environment while they move from surviving to thriving, coordinate and generate resources for youth, families, and the Bremerton community, develop a unified message to end substance abuse and communicate common values of respect, and empower today's youth to be Bremerton's better tomorrow.
I think that fits everything that is in the program that you've addressed. We all have packets to read about symptoms, about what causes it, how to prevent it, but I like it more as an affirmation in your vision statement, because many of us during the holidays will say, well, I'm going to take and make a resolution, and I resolve to do something. But once you have interrupted that resolve, then you say, well, it doesn't matter because I've already done it. So it doesn't keep you on that track. Where an affirmation, it could take you the entire year to reach that affirmation, but you keep that positive thought going. So how many people have you been reaching, or do you have it in all the classrooms? How does Patty work? Let's go to Jeff. How does Patty work with the individual students?
Well, there's a variety of groups that she has going in our high school. One would be students that have previously had a substance abuse problem, have stopped, and have a support group, and they meet throughout the week with her. She has another group for students who don't use themselves, but maybe in a situation where they have loved ones that abuse
Family members or
right,
best friends.
or friends or whatever, and so there's a support group for those students. She also works just educational awareness about drug and alcohol's effects, and then finally she receives referrals from staff members if they're concerned about a student that has indicators that make them believe that something's going on and just want someone to take a closer look at that student. She'll receive a referral, and then obviously if a student ever is on the small percentage of a student that actually is under the influence or is using where there's something related to school, then that's an automatic contact with her and those resources.
Sandy Hook, I'm real positive about thinking having counselors or having programs like you're describing and having Patty on campus where you have something that someone's acting differently. That is where you want to take and intercede and prevent rather than have somebody flip
Right.
or go into a situation where we have a result like that. So, and you wanted to add?
Yeah, I was just going to add, one of the things unique about Patty's job is she gets to do both sides. She gets to do what we call universal prevention. So all ninth graders here at Bremerton High School receive what's called Prevention Ed Series. So where topics are covered like what is it like to be an adolescent? What stresses do you face? Drugs and alcohol, the family. And so every ninth grader receives that, as well as Jeff mentioned all the intervention type of services with kids. Patty also facilitates a group for students who want to be leaders here at the school that want to send the prevention message out to other kids, and they facilitate activities as well.
So like a mentor.
We call it SAD group, Students
SAD.
Against Destructive Decisions, and that's really that group will link up with our coalition as well.
That's great. If you, in talking about the curriculum, is that in health that they have that?
It goes through mostly all the ninth grade health classes, or where they can get a health credit. That's correct.
And so how long does the program last? How long will you be able to have this at the high school?
Good question.
Funding?
That's kind of up in the air. Our funders haven't really said the set. I mean, we envision it for at least 4 to 5 years. Correct me if I'm wrong, Laura.
Yes.
But we really haven't been given the exact clear guidance on when does that end.
So maybe, like you're talking about these mentors, or the SADs, that if they get enough information and there was going to be a reduction in the program itself in the future, you would still have trainers training the trainers or someone that could carry on the program without the funding because you have someone that's actually been learning about prevention.
Yeah, sure.
So one of the pieces that we have involved in our planning of this organization is sustainability. So we're working from the beginning to see that this can continue beyond funding.
And I know that you're looking at smoking. Smoking is addictive. We know that just by how hard it is for people to quit. One of the things that you've started is you have a sign that's been made where there is no smoking in a park area. Bremerton is just perfect, and I know that we've talked about it, Michelle. We're building a beyond accessible playground almost in the center of Evergreen Rotary Park. Knowing that that's for young students or anyone that has some very challenges with how they get around, they're allergic to sawdust, they're allergic to a lot of things, and smoke is very much an allergy. So we want to, and I think that our Director of Parks and Recreation is taking that to the Parks Commission this month, and they're going to be talking about having a posted sign, and the sign reads?
It's a no smoking sign that says this park is smoke free, which is just really exciting because not only what we know is when kids see unhealthy behaviors, that contributes to what their perception of what the normal looks like. And so the more that we can have kids be in places where they're not seeing that, that's going to be really helpful and be a prevention strategy for them.
And I think it's great, and I think it's wonderful that our first park and this accessible playground, they're starting this summer, so hopefully in 2013 we'll actually have that sign on display.
Yes, and then hopefully after that we can, start hitting all the parks. And we work real closely with the health district. Actually, the sign comes from there. We have a countywide called Count on Kitsap Coalition, and that's where those signs actually came from. So we're partnering with them. So again, starting in Bremerton is great, and then hopefully we could go out to the other cities as well.
I think it's great that this program is strong here. And how long has Patty been with you, Jeff?
Wow.
I would say at least 10.
She's been with the ESD for probably 15 years. At Bremerton High School, I'm going to say 5 or 6 years probably. Again, because she's been at different school buildings, but she's been here
and
for quite a while.
always in the same capacity with prevention. But this coalition is bringing this out to the public because I knew we had specialized people on the campus. I didn't realize that we were already addressing this issue, but I think by going public and by having a coalition with so many more areas of our agencies, we're really going to reach the public and reach them at a younger age. What is the statistic about when kids first get introduced?
I don't have a specific statistic for you. I know, unfortunately, age is, we have experience with 8-year-olds and 10-year-olds using substances. I can tell you at the county level, if we look at kind of a 8th grade, about 7% smoke cigarettes within the last 30 days, 12% have drank alcohol, and about 8% have smoked marijuana. And that about doubles when you get to 10th grade. And although those statistics are alarming, one prevention approach that we really embrace is the social norms approach, which is not to focus on the number that's using, but really to promote the fact that most kids in any of our schools don't use substances on a regular basis. And so that's one strategy that we really, because if kids think most kids use, it puts them more at risk. And we know because of unhealthy behaviors, they stand out, that often adults and kids have a misperception around those type of behaviors.
What is PRI, Prevention Redesign Initiative?
PRI is the state's redesign of how they're delivering prevention services. So with the declining funds, what they've done is kind of take a look and go, okay, so we can spread these funds farther and farther and farther until they're really not as effective, or we can focus in on our highest needs communities. And so that's what they've done. They've not just chosen the highest needs communities, but communities that are ready and welcoming and open to this collaboration effort. And so Bremerton is absolutely #1 on Kitsap County's list for collaboration.
I think it's great too because we have one high school and we have one middle school. So as those students funnel through 6 to 8 and then the 9th grade, they're going to take, and again, that mentoring program and having other people involved. I'm just excited about what you're doing. And why now?
Why now? That's a really good question. I think it has to do with prevention services have always been delivered to prevent substance abuse. With recent economic times, they have fewer dollars. And so they're looking at how can they concentrate those efforts to be most effective.
Well, and as you know, we've got 5210, we've got nutrition programs. I know that the school district has a nutritionist who plans those meals, and that you bring fresh fruit and vegetables into that the kitchen. We're lucky because we have that central kitchen and those 5,000 meals that feed all your students. It's pretty amazing. I think with the nutrition, this is again the perfect time, and with currently Michelle Obama has been get out and do activities and jumpstart and
focus on health.
Focusing on health, and I know our health district is doing the same thing. So that same message is going through different agencies, but it starts with our youth. I've said this before, and I know recycling started. The 3rd graders came home and they said, "Mom, Dad, you have to take and recycle." And this is a perfect thing. Our students do come home, and it changes the behavior of families as well. How can our citizens or organizations get involved?
Well, they could contact the high school and say they would like to become involved. They can contact me over at Kitsap County, and I'd be happy to have them come to a meeting. They can just show up. We have our Bremerton Coalition meetings on the 2nd Thursday of every month from 3:30 to 5:30 here in the high school.
That's great. So people can get involved. We're going to show that number on the screen as well. I can't tell you how pleased I am to have this information come out to the public, that we can participate and that we can watch the results of what you're doing. Thank you, Laura. Thank you, Jeff. Thank you, Michelle. It's been a joy.
Thank you.
Join us next time with Growing Bremerton Together with Mayor Patty Lent. And one quick thing before we close, I'd like to give you this very important information. This year, our community will have the unique opportunity to participate firsthand in a landmark new cancer research study, Cancer Prevention Study number 3, or CPS 3. This is an opportunity for those of us who have never been diagnosed with cancer to actively get involved in the very research our efforts worldwide help to fund, to help prevent cancer for this and future generations. Enrollment will be taking place throughout Kitsap County from April 3rd until the 10th, including your local YMCA. For more information, please visit cps3kitsapcounty.org. Thank you.